what I wanted to do right now is explain to you how I treat the cervical spine, and versus what you might be seeing at other clinics. You're looking at the profile of the cervical spine right here, and you can see you have your jaw component, you have your ear component, and you have your upper vertebrae component here, which we call the atlas, okay? And the axis. The atlas holds up the axis, which holds up the world, and that's what our motion comes from. This is a very powerful area of the spine because the muscles in this area have more receptors in it than any other muscles in the body, because our body, our brain wants to be held level with the world. So when a person comes in with upper cervical spine, like I say, it's all connected. We can have sinus, we can have vertigo, we can have headaches, numerous types of headaches. We can have neck pain, we can have irritation in upper shoulders in that area. But what I want to do is, and I do manual adjustment on the cervical spine, but I also use an activator, which is a high velocity, low force technique. They're all very safe, but it's for somebody that doesn't really want the manual adjustment, we have that available to them. So I'm going to demonstrate some manual technique adjusting, and again, it's gentle. I adjust children, and it's super gentle. It doesn't have to be what you think it is. But I just want to cover this right now while we're here. A lot of people are under so much stress, their jaws are really tight, and that's one thing I really do on my patients, is I check the jaw and the function of the jaw. And obviously the right jaw is connected to the left jaw, but just go ahead and open and close once. And I palpate that, and you can definitely identify with when a patient has a problem, one jaw is tighter, and I have techniques to do that. One of them is the activator, and other one is just simple molding of the jaw. But a cervical adjustment is something that I do all day long. And when we get in here as chiropractors, we palpate the motion of if that's moving or not, and it's usually a giveaway on which side is moving. And we simply contact on the vertebrae, and we get in position, and she can tell you right now that feels really good. I mean, and it does, and the adjustment is literally just a little bit more than that on the cervical spine. And I know there are chiropractors that put videos out there that's not me. I mean, it's not. It doesn't have to be that way at all. It's so effective, and just we get that in the normal position, and with the training of the chiropractor, this is what we focus on. We just give it a nice, low force, high velocity adjustment. And again, one of the other way we have a drop technique for the cervical spine that I won't demonstrate right now, but and we can do that. I don't do that very often, I'll tell you. And I'm going to have you lay face down still. And we can use the activator again, which again is one of the highest researched adjusting instruments ever. Just palpate the component after here, and we can adjust at that area to get the joint mechanical receptor moving, stimulate the receptors within the muscles, and then we can also work our way down. But I also do what they call a Gonstead adjustment. If patients like to be seated, I can adjust them seated in a cervical manner, like so and like so. I don't use that adjustment very often because I get a better adjustment when the patient is laying down and relaxed. Also, while I'm here, I have techniques. If I need to, I work on the shoulder. I'll come around this way. No, I'll come around the other way. I work on the wrist. People who use a computer a lot, I work on the wrist, adjust the elbow. We work on the shoulder. I'm going to grab my hand. When we're talking about carpal tunnel, if you could see in my hand here, the nerve runs right through here. when we work like this all the time, the carpels press on the median nerve and causes pressure on that nerve. And so when we come in here and we adjust that, we very gently traction adjust this, turn it over using the thumb, and we adjust this, we adjust the elbow. So I literally will adjust the wrists, elbows, shoulders, everything when a patient comes to see me, if they so choose. And that's something that I may do a lot different than other chiropractors, because I work on the joints a lot. So.